my dear students. Today we are going to study about the numericals. Numericals are mainly asked from PSM. So one numerical question is must in all type of competitive examination, whether it is FMG, NEET PG or NICT. So you have to make sure that you should not leave that question. Instead, you can do it in the last. Numericals are always preferred to do it in the last section of the exam, so that you will get 5 to 7 minutes. You should spare 5 to 7 minutes for this numerical based question. Make sure you should study all the types or all the formulas. Then you should read the question properly. You should do the mathematicals very speed and accuracy is very important in numerical based question. So today I have taken few questions from the U world, that is USMLE based question, so that it is very easy to solve even the difficult, easy or moderate type of questions if you do this kind of question or make practice of this kind of question. So let's solve first question. A new combined chemotherapy and immunotherapy regimen has been shown to significantly prolong survival in patients with metastatic melanoma. If widely implemented, one of the following changes in disease occurrence measures would you most expect? Okay. So here, make sure incidence and prevalence. What is incidence and prevalence? Incidence means the new case. Yesterday we have discussed it is new case. New case is the incidence, and prevalence means new plus old. So incidence means new case out of total population, and prevalence means new case plus old case by total population into 100. So prevalence is always a proportion and incidence is a rate, that is into 1000. Okay, this is a basic formula you have to study. And what are the changes that is happening according to the treatment and the preventive measures in incidence and prevalence, that is we are going to study next. So what happens to incidence and prevalence if preventive measures are taken? If preventive measures are taken, incidence will be decreased, that means new cases won't happen, and prevalence also decrease. And you have to remember this formula, that is prevalence is equal to incidence into duration. That means prevalence directly proportional to duration. If prevalence is increasing, duration also increase. That is a formula you can by heart by this mnemonic PID, that is pelvic inflammatory disease. P is equal to incidence into duration. Okay. Then if it is preventive measures, we studied that incidence decreases, prevalence decreases, duration decreases. And if it is treatment, if it's treatment that increases the survival, then incidence remains same. Then what happens to duration? That increases the survival, means duration increases, then prevalence also increases. That is the second point. And third point is, if it is treatment that cures the disease, very important, if it is cures the disease, then incidence remains same, duration, cures the disease means duration decreases, prevalence also decreases. And this is the basic steps you have to study for solving this kind of questions. And let's go to the question again. Let's go back to the question, that is here in this question, new combined chemotherapy and immunotherapy regimen that prolong the survival. We have already discussed, if it is prolong the survival, then duration increases, so that prevalence also increases, incidence remains same. So option number D is the right answer. Understood all of you? So revise this question and you have to solve more question based on this type of concept. Okay. Once more I will repeat in this question, chemotherapy and immunotherapy, that increases the survival, that means prolong the survival. If it's prolong the survival, duration increases. If duration increases, according to the formula, P is equal to I into D, duration increases, prevalence also increases. That means prevalence directly proportional to the duration. Incidence remains same. So in this question, D is the right answer. Okay, Pakka? You all understood, right? Then let's go to the next question. Next question is question number 2. The incidence of diabetes mellitus in a population with the very little migration has remained stable over the past 40 years. At the same time, prevalence of the disease increased threefold over the same period. Which of the following is the best explanation for the changes in diabetes occurrence measures in the population? So, in this question, it is written that prevalence increased threefold the same time. That means prevalence is increased. If prevalence is increased, duration also increase. Incidence remains same. Which of the following is the best explanation for the changes? That is the question. Which of the following is the best explanation for the changes in diabetes occurrence measure the population? It's written that incidence remains same. Incidence of diabetes is stable over the years. So this formula P is equal to I into D means incidence same, duration increase, prevalence increased. So which is the best explanation? Let's go to the options. Increased diagnostic criteria, poor event ascertainment, improved quality of care, increased overall morbidity, low set follow-up. Which is the right answer? C is the right answer. If the incidence remains same, duration increases, prevalence increases, that means that prolong the survival. That means incident cases are remaining the same, there is no more incidence. That means that is a best explanation for this question is improve the quality of care. That's why incidents are remaining the same. So the best apt answer for this quality answer is improve the quality of care. That is the best option out of this question. Okay. Then let's go to the third question. In a survey of 10,000 IV drug abusers in a town A, 1,000 turn out to be infected with hepatitis C and 500 infected with hepatitis B. During 2 years of follow-up, 200 patients with hepatitis C infection and 100 patients with hepatitis B infection died. Also during follow-up, 200 IV drug abusers acquire hepatitis C and 50 acquire hepatitis B. The following is the best estimate of the annual incidence of hepatitis C in IV drug abusers in town A. So let's solve this question. It's written that in a survey of 10,000, okay, in a survey of 10,000 IV drug abusers, 10,000 turned to be infected with hepatitis C. So 1,000 already infected, so we can't do anything. So out of 10,000, out of this 10,000, 1,000 already infected. So never mind this so never mind this 1,000 because it's already infected. So out of 10,000, 1,000 turned to be infected with hepatitis C. So rest is 9,000. We have to do all the survey in this 9,000. We have to consider rest 9,000 people in the survey. It's written, the question is best estimate of the annual incidence of hepatitis C infection in IV drug abusers. That means yearly annual incidence means 1 year. It's written during 2 years of follow-up, 200 patients of hepatitis C infection and 100 patients with hepatitis infection already died. Also during the follow-up, 200 IV drug abusers acquire hepatitis C. Means in 2 years, it's written, I will make it clear or make it in a simple way. It's written out of 10,000, 1,000 already infected. Okay, so you have to do the survey in this 9,000 people. Okay, In this 9,000 people, it's written during 2-year follow-up, 200 people are infected with IV drug abusers are infected with hepatitis C. The question is we have to explain or we have to find out the annual incidence of hepatitis C infection in IV drug abusers. Okay, so in 1 year it will be 100. So the answer will be the answer will be 100 in 9,000 people. Understood students? So let's go back to the question again to make it clear. In a survey of 10,000 IV drug abusers in town A, 1,000 turned to be infected with hepatitis C. So 10,000 minus 1,000, that will be the 9,000, right? It's 9,000 people are in the survey. In 2-year follow-up, 200 IV drug abusers have hepatitis C. So in 1 year follow-up, it will be 100. So annual incidence of hepatitis C infection in IV drug abusers will be 100 per 9,000 people. That is the answer. So got it? So today we have studied 3 high yield questions and we have studied the topic related to that particular kind of question. We have studied almost, I think you have covered that incidence, prevalence, voila questions and few numerical based questions according to that. So tomorrow we will study maternity rate, case fatality rate. So many formulas are there, right? So we will study and make it clear. So this that's all for today. So thank you guys. Please do subscribe my channel. Please follow this channel. Please revise. Today itself we have to solve this kind of questions which we have discussed in this class today. Do more questions and make thorough with the topic. So thank you so much.